Hello, lovelies. Happy New Year. Welcome to the year 2026. Welcome to News Bob this channel. I create content on health, lifestyle, and fitness. And in today's video, we are going to be discussing on how to test yourself for signs of dehydration. You actually don't need to get to the hospital before you can tell that you're dehydrated. But most times we ignorantly ignore them because we don't know what the signs of dehydration is. Today in this video, we are going to be discussing the simple practical steps on how to test yourself for signs of dehydration. Yes, it is a do it yourself. Okay, it is a do it yourself approach. You don't actually need a doctor to tell that you're dehydrated or a nurse to tell you that you're dehydrated. With simple knowledge on what the signs of dehydration is, you can actually tell when you are dehydrated and what to do in order to hydrate yourself. Okay, before we dive into the practical steps on how to test yourself for signs of dehydration, I'm going to do a little bit of introduction of what dehydration is. I encourage you to watch this video. At the end of this video, you will not only know what dehydration is all about, you will also know the signs to watch out and also how to test yourself for dehydration. Yes, when you know what dehydration is and the signs, you can actually know what to do in order to prevent dehydration from occurring. And in a severe case, you don't need anybody to advise you to head to the health facility for adequate treatment. So without further delay, what is dehydration? Dehydration occurs when one loses more water than he or she takes in. Yes, dehydration is when you lose more water than you take in. For instance, you're stooling or vomiting and you're taking little or no water. As you're stooling, you'll be losing fluid from your system. And if you're not taking adequate water to replace it, you become dehydrated. So in a nutshell, dehydration is you losing more water or more fluid than you take in. There are so many things that can cause dehydration. So the causes of dehydrations are heat, during hot weather like this, and you sweat excessively. The more you sweat, the more fluid you're losing. So in a severe cases where the weather is so hot, in a harsh weather condition, the more you perspire, the more you are losing more fluid. The more you are losing more fluid, the more dehydrated you become. So the second thing that can cause dehydration is illness like feverish condition. Okay, talking about prolonged fever, the more your body temperature becomes hot, the more you'll be losing fluid in your system. And another health condition that can also cause dehydration is diarrhea. Talking about prolonged stooling, not just stooling for once or twice. The more you stool, the more fluid you are losing. It's necessary that when you are stooling or when you're having diarrhea, you should watch out for the signs of dehydration in order to know what to do. Another health condition that can also cause dehydration is diabetes. The diabetic people, they sweat a lot, especially when they are having hypoglycemia as a result of not eating, or hyperglycemia when the sugar level is excessively high. The individual will be perspiring, will be sweating. So for individuals with diabetes, that is a sign. Once you notice excessive sweating, it is an indication that either the sugar level is low or the sugar level is high. Then another condition that can cause dehydration is also kidney problem. Individuals with kidney problem, most times they urinate frequently. Another health condition that can also cause dehydration is vomiting, excessive vomiting. The more you vomit, the more fluid you are losing. Or if you don't visit the health facility for adequate care to replace the lost fluid, you also become dehydrated. So, health issues like the ones I've mentioned and many more causes dehydration. Thirdly, another condition that can cause dehydration is poor fluid intake. For the athlete or individual who always engage in physical activities, physical exercise, so little or no water during your physical activity exposes you to dehydration. So these are the three things that can cause dehydration. Okay. And then signs to watch out for dehydration is dry mouth or dry lips. If as a person you stay with it sometimes and you notice little or no saliva in your mouth, it's an indication that your body lacks fluid, you lack water. And then if you have this cracked lips, okay, it is also an indication that you are dehydrated. Occasional dizziness, okay, is not all dizziness that is associated with malaria, typhoid, or any other health condition. Some dizziness is a sign that you are dehydrated. So it is not all dizziness that is a sign of health issues. Some of them are dehydration. That once you take enough fluid to flush your system or to hydrate your cells, you'll be okay. The dizziness will disappear. The next signs to watch out for dehydration is poor urine output. When you want to pee and you just notice that the urine you're making is just a small quantity, is an indication that you are dehydrated. Another way too is when the urine color becomes too concentrated or deep yellow color, it's an indication that you are dehydrated. Then another signs for dehydration is once you notice that you're thirsty, you don't need anybody to tell you that you're thirsty. So once you are thirsty, what should you do? It's a sign that dehydration is setting in. So these are just the few. There are so many more. I don't want this video to be too long. So these are the few signs of dehydration. And then the most important thing here is how do you check yourself for signs of dehydration? We've talked about introduction of what dehydration is. We talked about the causes. We've also talked about the signs to watch out, which is an indication that you are dehydrated. Now we're going to be diving into the main point, which is factor steps to check or to determine if you are dehydrated or not. Is one, when you pee, okay, and you notice that the color of your urine is too concentrated, like the one you're seeing here, or dark yellow. The normal urine color is pale or light yellow color. So whenever you use the toilet and after peeing, you realize that your urine color is dark or deep yellow or too concentrated, is an indication that you are dehydrated. Okay, so dark yellow color urine is a sign that you need to wash out to know if you are dehydrated or not. Second practical step to wash out for dehydration is little urine output. Going to the toilet to pee, okay, to urinate, and you realize that you're making little or no urine, is an indication that your system is void of fluid. Your system is dehydrated. So little quantity or little amount of urine produced is a sign that your body is void of water, that you are dehydrated. Your body is void of fluid. Okay, so that is the second thing to watch out. The third practical step to determine if you are dehydrated is the skin tongue test, skin tongue or skin pinch test. Okay, so what should you do? Now you bring out your hand this way and then you give yourself a little bit of pinch. Okay, within few seconds, and you release your hand. It is expected to snap back immediately. Okay, you can see my hands are snapped back. The pinch, just give yourself a little pinch and then release it. You can see it's expected to snap back immediately. If it delays in snapping back, it is an indication that you are dehydrated. If it takes a very longer time to snap back, it means you are dehydrated and your body is void of fluid and you need to do something. So it is called skin pinch or skin tongue test, and it is quite accurate. Like, see my hand this way. This is it. You can see it has snapped back immediately. That is a sign that I am not dehydrated. It is so accurate. You don't need any medical personnel to tell you this. If actually you can follow these practical steps, it will tell you better when you are dehydrated. And if dehydration is not just as a result of loss of fluid, if it's as a result of other health issues, no matter how you take fluid to hydrate yourself and your skin still find it difficult to snap back, then you need to visit the hospital, because it might be a pointer that it is not just ordinary dehydration. There might be underlying health issues that may be responsible for that dehydration. So knowing these practical steps will help to keep you away from dehydration. And if you are dehydrated, what should you do? Is another topic for another day. I'm Netbab D. I create content on health, lifestyle, fitness. If you have watched up to this point and you haven't subscribed to my channel, you're not doing the right thing. Please endeavor to subscribe to my channel, okay? And don't fail to give me a thumbs up, okay? Give me a thumbs up, give me a like, subscribe, share this video to enlighten others as well. Watch out for the next video on what to do if you are dehydrated. Thank you for watching. Love you guys. Do have the best of the new year. Bye.